you all. I jotted down some of the countries that you are in just so I could say hi specifically to those of you who are in different parts of Africa and Rwanda, Kenya, Nigeria, Ethiopia, Cameroon. Welcome. So excited to be here. As John mentioned, I am coming to you from Los Angeles. I work at UCLA in radiation oncology, and I have worked in the medical field as a social worker therapist for about 3 years. Have about eight years of experience as a therapist and social worker, and I'm just excited to talk about mental health. I'm very passionate about mental health and really just excited to dive in. As John mentioned, oftentimes as providers, we can pick ourselves last in a lot of ways, whether that's professionally in the work that we're doing with our patients individually, on teams, right, interdisciplinary teams, whether that's in our personal lives too, and all of that is intertwined in what we do. I'm gonna jump right into things. So no disclosures, no conflicts of interest to report. Quickly, just our session outline for today. We're gonna have 3 sections. The first section really talking about mental health for us as providers, why taking care of our mental health really matters, our work and that impact on our mental health, what we can do to take care of ourselves. I'll provide some tangible things that we can do, some things you can put in your pocket, in your tool belt to be able to go back to those things. We're going to also talk about our mental health for our patients and just what we can do within the health system to really support them, helping them cope, discussing how we can manage stress, especially as they're going through treatment, and even the role that grief plays. And then we'll also just talk about in general mental wellness and mindfulness, some tangible ways to have positive and adaptive coping, and also just discuss ways that we can be mindful and why that's important. So we're going to first acknowledge the fact that it is Mental Health Awareness Month. At least I know that this is a global trend, having Mental Health Awareness Month, and at least in the US, the National Alliance on Mental Illness has selected this theme for this year, which is "In every story there is strength," which I felt was very appropriate for even this discussion. In oncology, I think a lot of times we can look at our patients and be like, wow, they're going through this, they're really strong, and even highlighting that in their stories, their individual journeys, there is strength. Mental health can be a challenging topic to bring up, and it can be difficult to talk about even culturally. I'm sure for even all of you in your different separate countries, or even your separate like cities, towns, communities, villages, everything's going to look different culturally for you in terms of how mental health is discussed. But it's really important for us to be able to be both aware of our own mental wellness, but that of our patients too. I also just want to note that this topic at large can bring up a lot for people. I would encourage you and invite you today to practice some self-compassion. We are all coming to this conversation and this topic from different starting points. Some of us a little bit more comfortable with the discussion and the topic than others, and that is okay. Give yourself some self-compassion today as we discuss and learn together, and maybe even bring up topics that we didn't consider before. So I'm going to start our time together with actually a minute of mindfulness. It might be a little bit more than a minute, but we're going to practice starting right off the bat with a way that we can engage in mindfulness. Mindfulness is in general a practice of being present and aware of where we are right now in the present. We're constantly being bombarded by outside stimuli, right? Whether that's at work, at home, within our communities, there's a lot going on around us, right? Whether the attention of someone that we're interacting with, if that's a patient, maybe it's, okay, I need to remember to jot this information down and write it out, and I need to remember to put this in a chart, or maybe I'm getting a message from someone, an email, a text message, a phone call, right? We're getting bombarded by the outside world constantly. And even throughout this lecture, we might be getting the attention of people around us, right? And mindfulness is the kind of acceptance of that's going to happen, and bring us back to the present and the now, what is happening in front of me. Mindfulness really is just, again, practicing that self-compassion. This exercise is called 5, 4, 3, 2, 1, and it's going to really elicit our different aspects of our senses. So it's going to talk about sight, touch, hearing, smell, and taste. And if you're comfortable, I want to invite you all to take a part of this practice. We're going to start by having breaths within each moment. This is something you can do on your own. Practice, whether it's in a moment when you're talking to someone. You can practice it on your own, or if you need to take a quick step aside during the workday, you can do this really quickly. It's something that's really tangible, something that you can do fairly easily. So if you're comfortable, I want to invite you to join me in doing this. And we're going to start by taking a deep breath in through our nose and out through our mouth. And we're going to think about what are 5 things that you can see around you right now. Look around, maybe things you didn't particularly notice before. I didn't notice that the pen I'm using right now is a little broken. That's one thing I didn't notice before I just grabbed a pen. Maybe something around you is you're noticing a fan and the fan is moving. What are 5 things you can see? Okay, we're gonna take another deep breath in through our nose and out through our mouth. What are 4 things you can touch around you? Anything. It could be similar consistencies of things around me. I have my water bottle, I have the desk in front of me, I have my sweater. What are 4 things that you can touch? I'm going to take another deep breath in through our nose and out through our mouth. What are 3 things that you hear right now? Maybe it's me talking. Maybe for me, I have a clock in the room that I'm in and I'm noticing the ticking noise. What are some of those things that you can hear that maybe you didn't pay attention to before? Maybe a car driving by. Another deep breath in through our nose and out through our mouth. What are 2 things that you can smell? Maybe you just had dinner. Maybe you have dinner in front of you. Maybe you made a cup of tea. I just had breakfast because in LA it's 10 a.m. so I can smell my bagel. But what are 2 things you can smell? All right, one last thing. Deep breath in through our nose and out through our mouth. And what's something that you taste? Usually when I do this with a patient or client, if they're able to, I'll hand them like a little treat, maybe especially in radiation oncology, maybe like a ginger chew to give them that calming moment in the now. Maybe their stomach's a little upset, so they're eating some ginger. But this is a practice I just really wanted to open with because we all know what our senses are, right? It's okay if you jumble this up and are like, which sense came first? But just thinking through 5, 4, 3, 2, 1, what are the different senses around me? Or even if all you remember is to do one of each of those senses, just taking a moment to be present in those. So thank you for those of you who participated, and I hope you are feeling good coming out of that little mindful moment. Okay, so part 1 we're going to talk about is mental health for us as providers. We're going to discuss why it's important and how we can really take care of ourselves. So to jump right on in, mental health obviously impacts all the aspects of our life, right? The social aspect, whether that's within your community, the family that you live within, your friends, the emotional part of our life, it impacts our behavioral aspects, right? What we do and how we engage within the world, psychologically, what's happening inside our mind, what we're thinking of. It can even impact us biologically and physically, right? Those psychosomatics. Sometimes we feel what's happening in our bodies, right? It really impacts our relationships within how we engage within our entire environment. One of the cornerstones of social work is the idea that we exist within an environment, right? It's the person within the environment. And mental health really even looks at all aspects of those and how we are interacting with those things. Obviously, that's an important aspect. It's still a part of our health, right? And it's more than just the absence of like mental illness. It affects our thinking and our behavior, our mood, our day-to-day. It's a state of well-being, and it really is where we can recognize and acknowledge maybe stressors in life, things that help us to be more productive, maybe things that are hindering our productivity. It really encompasses our overall well-being. It affects how we think, how we work, how we act, right? And even when we're holding on to stress or when our mental health isn't doing so hot, that can also create negative health outcomes, right? It can lead to negative things. So I really like this little image of this person. It looks like a tree and it's all these different aspects of their life. I don't know if you guys have pets or if you have a family or if you like to engage within the world, right? All of those are different parts of our mental health. All of that impacts us. And then that mental health impacts how we interact with those things. So why it matters, obviously as healthcare workers, we are prone sometimes to suffer in silence. especially our nurses. You guys are doing a lot. You guys are oftentimes carrying the team. I work with a good team of nurses, and I often see how they just go, right? Especially on those 12-hour shifts. Some nurses do 10s or 8s, but you guys are just doing your role and pushing through sometimes, right? And so I think even as healthcare workers, we can oftentimes just do what we have to do to get through, push through, right? We can say we have to do it, has to get done. But obviously, the work we do is challenging. It's important to make sure that we are also meeting our needs, right? That we're also attending to us, especially because the work that we do is not easy. It's not easy to see people suffering day in, day out. It's not easy to watch somebody have to face one of the largest health challenges in their life, right? But we do that day in and day out. So it's important for us to really attend to us so that we can continue to do the work that we do. I know that all of you are here because you're passionate about this, because you want to continue to provide quality care to your patients, and that's a wonderful thing. But if we're not taking care of ourselves, then we can't continue to do that, right? There are a lot of assumptions about diagnoses. I selected in this slide to really highlight depression because oftentimes we do see that depression is like a large influence in how we interact day to day with our lives. And depression is a higher prevalence in healthcare workers, but also in our patients. And we're going to talk a little bit more about that as well. But there can be a lot of stigma around mental illness. And there can be a lot of assumptions that maybe like a diagnosis like depression can be something that will make us unable to provide the care that we want to provide. But that's not true. It's important that we acknowledge that whether that's a depression or anxiety, the different things that we're facing, they will impact us if we don't attend to them, if we don't take care of them, right? It's important to take care of ourselves so that we can do our job, not just for ourselves, but for our patients. And the World Health Organization actually collaborated on a strategic partnership with the World Innovation Summit for Health, so WHO and WISH. And they created in 2022 an initiative called Our Duty to Care, and they really outlined different evidence-based practices and interventions to be able to address the health of and mental health of healthcare workers. They really acknowledge specifically that healthcare workers do oftentimes suffer in silence and take on this duty to care, but that also has to come with different physical and mental protections. And later on, if you guys download this slide, I'm sure you'll have access to it. I included a link to be able to see what that duty to care PDF looks like, but also just really encompasses a lot of just taking care of ourselves and a lot of the discussion we'll have today. Obviously, the nature of the setting that we are in oncology is new and scary for our patients, right? It can be difficult for them. It's often something that they hoped they would never have to interact with and engage in. And yet it's something that we're dealing with every day, right? We're going into work, and this is something that can oftentimes kind of get watered down for us. And it's important that we don't allow ourselves to get hardened by that. That's a big aspect of taking care of ourselves, right? People are resilient, but medical exams can also feel invasive, right? They can feel, especially for our patients who are maybe having cancer of different reproductive organs, right? Like patients who are going through gynecological cancers, breast cancers, prostate cancer, right? That can feel invasive for them to have to get checked, right? For those medical exams. And sometimes that means that we're asking sensitive questions or examining those intimate body parts, right? And even delivering uncomfortable treatments to be able to help save them. But it's important for us that we're mindful of the fact that a lot of the people that we're interacting with within the healthcare setting aren't as used to what we're used to. Their lived experience, they're coming at it from the first time. If you think back to the first time that maybe you came into nursing, or maybe the first time you came into radiation oncology. Think about that. Think about, oh, okay, you're learning something new every day. You probably felt, I know for myself, when I came into radiation oncology, I felt like I was learning something new every day for a year. And it was fascinating and cool and really amazing to watch our patients go through treatment and come out on the other side. But at the same time, I was like, whoa, this is a different world, especially radiation oncology in general, right? When we think of oncology, we don't always societally and at large in the world always think about radiation. And so it's new, it's different, right? But people also bring in lived experiences when they come and interact with us in our clinics, in our hospitals. And that can include a history of things that we're not aware of, right? Maybe someone can be easily triggered and overwhelmed or overstimulated and anxious or stressed out really easily. I'm sure you can think of a patient, maybe even in the last week, who came in and sorry, who came in and was feeling overwhelmed or stressed out or overstimulated. We really
Kathleen,
don't know.
I'm just
Yeah.
going to take that little point to reinforce exactly what you're saying, which I think is very important for us as nurses. Very common for us to forget that this is an everyday thing for us as providers, but not for these patients. I've seen it myself as a nurse manager. I've witnessed some of my direct reports just rolling their eyes when patients have questions. Oh, we talked about this yesterday, kind of thing. But it's always a time to reflect that this is normal for us as providers, but this is a life changer for these patients. And it's easy for us as nurses to get, like Kathleen said, focused on getting them through, keeping on the schedule. But I think for my mental health as a provider, it always gratified me to take that extra time, whether it be taking them to an exam room, spending, it could only be 5 minutes, it could be that, but those 5 minutes explaining again like the rationale for treatment or what they're going through is normal can make a difference to them. And it's really only 5 or 10 minutes out of your time. And to me, to see that patient's worries get alleviated from that little time is what helped my mental health to get throughout the day. So I think that is very important to reflect upon, that we need to take time. This is new for them, it's not new for us. But like she also said, you could have a patient who's been diagnosed 6 months ago and they're just starting radiation. Radiation, as we know, is its own beast. They could be used to chemotherapy and the regimen there, but guess what? They're starting with this. These machines are a little intimidating. It's things like that. Yeah, they may have been diagnosed 6 months ago, but guess what? They're still absorbing this diagnosis. They're still going through active treatment, and radiation is a different beast than chemotherapy. Just keep that in mind. And I think for your own mental health, taking that extra time with that patient and alleviating their questions and their fears, for me, in my opinion, does wonders for your own mental health.
Yeah. No, I appreciate you highlighting that, John. I think especially because, as you said, we don't know exactly where they are coming from when they start their journey with us in radiation oncology. We learn that usually when they're coming in for their consult or maybe the first time we're interacting with them. And sometimes the radiation is at the start of their journey, sometimes it's at the very end, right? And so we don't know everyone's story when they're coming through. And we're actually going to even touch on that a little bit more later too, with this concept called trauma-informed care, and really how we can really kind of sit with acknowledging that everybody's coming from a different place, and how sometimes all it takes is taking a beat and practicing some mindfulness. Maybe you're noticing that your patient is overwhelmed and anxious, and really taking a little extra time to attend to that, really. So, yeah, the wonders that can do for us and as providers in our mental health, and being able to say, hey, look, I really attended to someone else and was able to also, in my moment, attend to me too. I really appreciate you highlighting that, John. So, we're going to kind of discuss next the impacts that can look like on our mental health. There are two different concepts that I really wanted to highlight, two ideas of what happens to us as providers if we don't take care of our mental health: compassion fatigue and vicarious trauma. I'm sure you guys know what it looks like for, or maybe have heard a lot of the word burnout. And burnout is something that I think we can umbrella, just use as, oh, that person is like really overwhelmed from work, they're just burnt out. But compassion fatigue and vicarious trauma really parse out and separate what is happening to us as providers when we do start to get to a place where we're not taking care of our mental health. Not to like scare people, but this is real, right? We want to be in our fields. We want to continue working as nurses and as providers. So we really do have to attend to ourselves so that we don't get to these places. But compassion fatigue looks like detachment. It's fatigue, dreading going into work. Maybe it's like easily being irritable or having a short fuse, not being as joyful, being dissatisfied with our work, having low motivation. This is also known as secondary traumatic stress and is characterized by a slow loss of compassion over time. So it's maybe a the beginning of your work, you had all this compassion for patients, but you were taking everything on and not taking care of yourself. And so it's this slow progression of maybe one day you're realizing you don't have the same amount of patience that you once had, or over time, you don't have that same level of like perseverance to not get angry when someone is maybe making us a little upset. But it can also happen quickly if we implement, oh, it can also happen quickly where we can like combat that if we practice things like self-care and mindfulness and really taking care of ourselves, right? Compassion fatigue is not something that's like the end all be all. We can really combat that. Vicarious trauma is very similar, but it's more of like this lingering emotional impact of the stories and the stress that we see through our work and also that we hear. So vicarious trauma can even happen outside of our work, right? Within the world that we're living within in today's day and age, right? It can be just witnessing the general fear that's happening around us from whether that's the work we're doing or in the world. And then that can carry on into the work that we're doing, right? It can carry on into what we're doing day to day. It's a preoccupation with those really awful, heartbreaking stories, and it can lead to just a challenge in regulating ourselves and being able to come back to that normal equilibrium. It can really also impact how we see the world around us. It can make us a little bit like less optimistic maybe, or harden us, right? I'm sure you can think about different ways that compassion fatigue or vicarious trauma might have either impacted you or someone you've worked with. But again, this is not the end all be all. If we really take care of ourselves, we can really combat that and challenge those things. So to dive a little deeper into that, compassion fatigue, like I said before, also known as secondary traumatic stress, was first used by a trauma expert, so someone who was studying really impactful negative events in people's lives. Trauma has also been called an adverse experience, right? So something negative. He described it as a state of tension and preoccupation with traumatized patients by re-experiencing the traumatic events, avoidance, numbing of reminders, and persistent arousal associated with the patient. So the work that we're doing, right, that is pretty traumatic. As we touched on before, it can be something new and stressful for patients. Compassion fatigue can be just that state of continually thinking about it. But again, a protective factor, so something that can help combat that, is self-care and taking care of ourselves. I know self-care is this term that has been, I feel like, really thrown around in the internet and in culture. We hear a lot about like self-care, blah, blah, blah. But self-care is actually attending to things that help promote our well-being. Maybe you like to go on walks, maybe you like to run, maybe you like to spend time in the outdoors, or maybe you really enjoy art and music. Maybe you are part of a religious community and that really feeds you. Self-care is being very intentional and mindful about doing those things. Resilience, I've thrown that around a lot too, is that capacity to withstand and recover quickly from the things that are happening. I like to use the example of like trees, specifically palm trees. I'm in Los Angeles. We have a lot of palm trees. I know that there are different variations of palm trees throughout the world, but we also get something in Los Angeles that are called the Santa Ana winds. Long story short, there are these really strong winds that come through certain times of the year. They're coming from a different part of the United States, and they come through and they push, and we get 30-mile-an-hour winds, sometimes up to 60, as you may have seen earlier this year. We had like huge gusts of like 100-mile-an-hour winds that created like fires around LA. But the palm trees in those winds, you can see them really moving back and forth. And sometimes you are looking at a palm tree, at least for me, and it's moving. And I'm like, that thing is going to snap in half. That's what it looks like, right? But resilience is the notion that once that 100-mile-an-hour wind, once that 30-mile-an-hour wind, and those winds can be the life that we're interacting with, the job that we're doing, the things that are happening in clinic, once that is ended and has left, our resilience is our ability to come back up and stand strong and tall. And you can probably think about it in like the plants and the trees around you where you live, right? Thinking about it in nature in that sense, right? That resilience is that ability for us to come back to and stand strong.
That's a great
And
analogy. Great
yeah,
analogy. That's a good analogy.
and I think also just in general, for our patients, resilience is that ability for them to bounce back too. They might currently be in a place where they are facing the most horrific challenge of their life, but they are trying to find new normal and new things that can strengthen them in this time. And sometimes we're dealing with patients who it's their first time going through treatment. Maybe they have a recurrence and it's the second, third, etc. time. But resilience is their ability to come back up and say, I'm going to keep pushing, I'm going to keep going. And it's also our ability to say, yeah, I'm going to also keep pushing and going. And there's a lot of research within the United States on resiliency and the notion that as long as we have other positive figures in our life, support systems, that our support systems really help us with resilience. So it's so important for us to not isolate ourselves and to really continue to have that support from those around us because we are social beings. We need people. I'm an introvert and sometimes I say, oh, I don't need people, but we need people. We need to be interacting with those around us. It really helps too with resiliency. We're going to talk a little bit more about the impact of stress, and we'll go a little bit deeper later, but there are different types of stress, but stress can also impact our body and how we physically feel. And I'm sure you've seen this in your patients, but maybe even in yourself when you've had a really stressful week, a really challenging week. Maybe you had a patient you were really connected to and they found out that their tumor or their cancer had grown or metastasized. The impact of stress on our body can present in a lot of different ways, and we'll go through that too. That can impact our digestive system, our immune system. It can impact our skin and breaking out. It can impact our mood and our irritability, right? So when we experience prolonged exposure to stress, that can manifest in a lot of ways, and it can result in what's called toxic stress. Not, like I said, not all stress is bad. There is tolerable stress, positive stress, there's toxic stress, and really the best way I can compare them quickly is positive stress is like the stress that's going to motivate you to do well on an exam, or the stress that's going to motivate you to get that promotion. Tolerable stress is this is like the biggest exam of your career that you're studying for, and maybe you have to study for months on it. But then once you're over it, your body's like, okay, you managed it, you were able to do it. Or maybe you have an unexpected expense and you're a little bit stressed out about it, but overall, you're able to get through it. That's tolerable stress. It's not ideal, it's not great, but you're able to get over it. Whereas toxic stress is this continual exposure to stress, and our body starts to interpret it with the littlest things, and it can present in our bodies in a lot of different ways. Like I said, it can impact us in many ways. That can look like emotional, physical, cognitive, and behavioral impacts. Here are a couple examples. Emotionally, it can make you more overwhelmed, worried, stressed, restless. Maybe that can then impact physically how you are sleeping, can impact muscle tension. I know when I'm really stressed, I carry a lot of my stress physically in my shoulders and in my neck. I can just really get tight, and I also store a lot of it in muscle tension in my jaw. When I'm really stressed out, I get headaches from the tension. Cognitively, it can look like difficulty concentrating, remembering things, maybe even how we talk to ourselves, a lot of negative self-talk. And it can even make us make poor choices because we're not thinking clearly, because we're so stressed out. We just make a decision and we don't think much about it. And then behaviorally, we can be more isolated. We can choose to maybe not do things we normally would have done, maybe choose to do things that we wouldn't normally choose to do, which is why self-care and mindfulness is important, right? Because then if we are mindful, or even if we're going through a stressful time, but we take moments to pause and say, hey, how am I doing for me? All right, Kathleen, check. How am I doing? If I can be able to do that without judgment of myself and really take a moment for me, then I can adjust. Okay, I think I'm stressed out. Let me take a beat. Maybe clinic is a really busy day. Maybe I need a quick 3 minutes and I need to walk away and just take some breaths. Or maybe at the end of my work day, I need to go on a walk because I just need to spend some time doing something that I enjoy doing. I love being out and about. And living in LA, the weather's usually pretty good, so I love to be in the outside world. Maybe mindfulness looks like not just emptying out what's in your mind, but really acknowledging what's there and saying, hey, maybe I need to really connect with the people that are around me, who know me, who can help me to address these things. So again, stress can present in a lot of ways, but mindfulness and self-care can really help us to attend to those things, to address them, and observe, okay, how did that impact me? And then how can I move forward? And again, with all of this, it's remembering that we have to take care of ourselves, right? You're human, you can only do so much. Make sure that you're checking in with yourself, but maybe even with others. I'm sure for some of you in your careers or in your clinics, in your hospitals, you have made some of the best friends that you've made, or you've made some really great connections. It's also spending time with the people around you that you enjoy and checking in with them too, being intentional about how you're doing that. Healthcare has really high burnout because, again, what we see is not easy to see every day, but we want to continue to be in the field that we're in. And obviously, again, you're here because you want to learn and grow and be here. It's important to take care of ourselves so we can continue doing that for decades to come, for years to come. And something that I also like to really think about when I'm thinking about self-care is what's something that I enjoyed doing before that I've stopped making time for? What's something that I used to always love, but for some reason, maybe the last 6 months, maybe the last year, maybe the last month, I've stopped doing. That's, I think, a really good measure of, okay, where am I at? What's going on? All right, so we are going to have a quick Zoom poll. What is vicarious trauma? We just discussed vicarious trauma. There are a couple different options that are going to pop up in front of you. A, feeling a sense of denial and worthlessness because of the experiences of others. B, the lasting impact of traumatic stories and experiences of others through the work in witnessing the fear and pain and terror of others. C, having no compassion, feeling burnt out and isolating from those around you because of the challenging experience of others. And D, listening empathetically to others and validating their experience. What is vicarious trauma? And I see you
People
guys
are
are starting
chiming
to already
in.
answer. Yeah.
B is leading.
Yes. So the answer is B. Let's see. It is, I will say a good handful of you also selected A. I will say that is a good trick answer. But yeah, the first answer, it would be considered burnout, which is obviously, like I said before, not something we want to experience. The third option is compassion fatigue, but the right answer of what vicarious trauma is B. All right. Move on to section part 2. This is mental health and just like overall well-being for our patients. We're going to talk about really doing your part within the health system that we're working within, helping our patients to cope and understand what's normal for our patients. We're going to talk a little bit deeper about the stress response and then trauma-informed care, as I briefly mentioned before, and the role that grief plays in this. I think what's interesting about the discussion of patient mental health is sometimes it's easier for us to talk about someone else's well-being, someone else's stress and mental health, and not our own. So this might be a topic that we might feel a little more comfortable with, but again, we're going to highlight really what we can do for our patients. Doing our part within the system is trusting in your team and the care to help our patients, right? So our health systems are challenging and we can help make it better by doing a couple of things. And this can obviously look different for every patient what their needs are, but as John, really highlighted earlier too, oftentimes we're so used to like doing the next thing. And for our patients, if we do things with clear communication and within a timely manner when they're coming in, that can make the world of a difference. Especially sometimes patients are coming in, at least to our clinic, and they get put in different clinic rooms as they're preparing for treatment or their first consult or whatever. And they're going into a room before they're meeting with someone, and we stick them in there, and then we leave, and then we come back, and we're like, oh, I have to do your vitals. And then our nurses leave, and they come back, and they're like, oh, someone else is going to talk to you. And then sometimes that other person is me, and I'm jumping in and introducing myself. And if we don't communicate with them, hey, take a seat here, we're going to do XYZ, sometimes that can make the world of a difference for our patients. Letting them really know even about changes or shifts that can happen. And obviously, as this highlights, preferably with advance notice, not just like day of, boom, actually it's going to be this. You're not getting 5 treatments, you're getting 10. Hopefully that's not what's happening. And obviously, hopefully it's not our nurses who are having to communicate that. But sometimes they're like, it just happens. You say something and they're like, wait, that's not what my provider had told me a week ago. But if we really are able to communicate things effectively and within good time, that can make the world of a difference for our patients. And even just following through on commitments we make to patients. I know for myself, oftentimes when I go in and I talk to a patient, I can have 5 things prepared for what I'm going to talk to them about and providing like psychological, emotional support. And then they are like, actually, this is what's happening. And all the 5 things that are in my hand, useless. I can throw in the trash bin, like, not necessary, which is okay. Sometimes we have to follow through with, okay, what's the need for our patient right now in the moment and attending to that and being okay with switching things up. Obviously, sometimes we still have to take their vitals. You still have to do X, Y, Z. So you still have to do those things, but really following through with what they need, but also what we've already told them we were going to do is important. And even empowering them to be advocates for themselves or even to help advocate with them. Sometimes they will ask a question. Hey, my doctor said this. I was really hoping this. Can you help me talk to them about that? Or maybe they don't even ask for the help and you're like, hey, would you like me to bring that up to them before they come into the room? I can let your doctor know that you had a question about that. Even something like that can help empower them to be like, oh, yeah, that's a great question. Something I like to do, and obviously I have a different role as a social worker in our clinic, but I like to tell patients, hey, if between now and the next time you see your doctor, you have questions, why don't you write them down on a notepad so that when you come in, you can ask the doctor and you don't forget because you might have brain fog. You might be going through a lot of things. Maybe you're doing chemo and radiation at the same time and you're like got a lot that you're juggling. Helping empower them with write down your question, bring that question to the next time you come in here can be something that can feel really basic for us, but can also really make the world of a difference for them. And it's
Kathleen, I gotta drive home that point even more so if you don't mind.
go for it.
So, me being a radiation nurse, you obviously kind of like how do I empower my patients on a day to day? And I know that sounds like a loaded question, but what I have found is the most important is whenever in your workflow that you meet with the patients, if it's during consultation, if it's right before simulation, what I would always like to emphasize to the patients is, especially in simulation, let's just take simulation, is like we know as providers that patient is might need to be in an uncomfortable patient position that I always stress to them, like you need to voice your concerns. If the therapist puts you in a physical position that you don't think that you could hold for more than 5 or 10 minutes, that's a problem. And you need to speak up for yourself because what those therapists will do is help make your positioning more comfortable. Because what a lot of patients don't understand is, oh, I'm just going to get through the simulation and maybe a few weeks into treatment, I'll put my arm down. But we know that they can't do that. So what happens in sim needs to be with them the whole time. And I know that seems like common sense to us, but it's not for them. So you can't just throw a soft pad on a table 2 weeks into treatment because that's not how it was presented at the planning session at the beginning. So just a simple thing like simulation and telling this patient to speak up for themselves and say, I am not comfortable in this position. There's no way I can hold this for 10, 15 minutes. It's just a little thing that we can do as radiation nurses to help empower that patient where they get a sense of, okay, they listened to me. They did put my arm in a position that I'm comfortable with. And that gives them not only the clear communication, but it's letting them know that the trust is in us, that we are listening to them. And I think that's a very good point in how we can empower patients little bit by the time, but it's a great thing that we can do to empower them.
Yeah, absolutely. And I think it's also important that like, we acknowledge that's one of those things that's so normal for us, but for our patients is again, this is the first time they're dealing with it probably, or maybe it's the first time in this part of their body that they're dealing with that. And so what might be like normal and normative for us is completely new, uncharted territory for our patients. So yeah, I really appreciate you highlighting that, John. And the next part is really just highlighting that there are things that we can do to give our patients a sense of control. I really love this aspect of the work that we do and even just what I do and how we interact with patients and really empowering them and giving them at least that little bit of hope that in all of these things, right, they have no control. Like they have cancer, they have to be treated if they want to be able to have the better like results, to have curative treatment, to have palliative treatment for whatever reason it is. Like there are a lot of things outside their control, right? This is the recommendation. This is what the research says. You have to do X, Y, Z. But if we do any little things to really empower them and give them that little sense of control, that can make a really big impact. So there's this little quote from a patient says, anything I can control, like what music to listen to or what clothes to wear during treatment, is helpful. I know that sometimes we have like certain patients who are like, I want the same song on repeat on the machine, and that's great. Some patients have their like go-to playlist or whatever, but giving them those little pieces of this is what we can do for you to be able to give you that sense of some part of this is also in your power, within your power, can really make a difference. And pointing out that there are things, focusing on those things that they can control, right? Making sure that they're following the instructions for their medication or for the skin products when they're going home to be able to help their skin to really placate some of the side effects, really making sure that highlighting you can do these best practices for like your wellness and your nutrition. I don't know if your clinics have access to a nutritionist, but like highlighting those things, right? Making sure that you speak up if you notice that there's something concerning, right? And really highlighting, okay, these are the things that are within your control, really stepping into that role. Even as a nurse, you are seeing things for the patient regularly and you're seeing this progression and you guys get to know the patients pretty well too. I think that's the cool part of the role that you play is you get to interact with patients. Sometimes they're coming in for weeks on end of treatment and you get to know them. And so you might notice things that are happening that are a little different for them or changes in their behavior or their demeanor. And if you even just mention something like that, that can also help them to speak up on what's going on, right? What they would like to do or something that's concerning for them throughout treatment and the relationships that they can learn from and explore, right? Encouraging them to have peer to peer mentoring relationships, to seek out support groups or online groups. I don't always love the online groups because it can also be a lot like very like doomsday, but some patients really love the online groups, the Facebook groups especially. They'll be like, I found this Facebook group and it taught me all these things. Hey, if that works for them, encourage it, but also highlight like every patient's different and where you're being treated is going to look a little different. But if that's going to be a forum for them to connect and build relationships, really highlighting for them, like, here are different things you can do and different ways that you can do that. And then if you don't have formal peer mentoring programs where you're at in your hospital, in your clinic, in your country, really looking for ways that you can also facilitate connections between other patients. I know that sometimes there can be like patients who will finish treatment and say, hey, if there's someone who wants to be connected to someone who's gone through prostate treatment, write my name down, my phone number, please share it. And if a patient has given you that consent to do that, help facilitate that. Because again, sometimes just knowing things, having an opportunity for questions to be answered can mean a world of a difference for patients. And then when it comes to just normal needs and psychological and social things that are happening for patients, individuals with cancer often experience higher levels of psychosocial stress, which means that a lot of their common fears can include, or concerns can include like fears, sadness, anxiety, anger, denial. A lot of these are aspects of even grief, right? They can be lonely and isolated, feel like they have no control. They can feel like I don't even like doing the things I used to do. My self-care concerns, like I can't do those things anymore. Maybe they have family members concerned with how that they can continue to provide more support for them. And even just like sometimes for patients who are going through treatment, it can be really like reconnecting for them to have more spiritual support. And that can look different for everyone. Sometimes I will highlight for patients like maybe you're not like a spiritual or religious person, but what's something that connects you to like the world that you live within, and really highlighting that for them because that is a big need. A lot of times, especially with cancer patients, they are looking for meaning making. They're looking for ways to connect with what their purpose is within the world, and if we can help facilitate that, can be so helpful. When it comes to helping them with coping, research indicates that most patients, about 75% of them, have the ability to cope within their diagnosis with like little to no to some support. So like the normal things that they have. As I said before, right? People are resilient. Think of that palm tree, right? Their ability to adapt in a crisis, like getting a diagnosis, having a recurrent disease, their ability to adapt to that begins when they start processing things, comprehending things better, asking more questions, and even just as they start to integrate the new normal into their day-to-day life, right? They still experience distress, they still experience stress, but they also welcome that new normal. And then there are some patients that don't have as easy of a time. And sometimes they need a little bit more support, a little bit more guidance with how to get there, right? Some of those other things we talked about before, giving them that sense of control through like connecting them to support groups, connecting them to other people, connecting them to, what it is that they're looking for. Support systems are so vital to coping for patients, for them to be able to really feel that they have not just the support of their nurses and their radiation therapists and their doctors, but also of their friends, family, and their community. Again, highlighting like the spiritual connections that they have, the neighbors, the community that they live within, right? Some of the communities that we live within are more collectivistic in how we take care of one another, right? Some of us are living within systems that the community that you are is not just your nuclear family, it's your extended family, and it's much larger than just a group of 5 people. And it's really harnessing that. Okay, how can these support systems that this patient has really support them through this, right? How can they advocate or even ask for help? Keeping in mind that for some patients, family systems are considered crucial to even their day in, day out treatment, right? Think of a pediatric patient. The patient is not just that kid, it's also their family, right? It's also sometimes we recently had a patient who had a twin. It's also sometimes their twin. That patient is not just always going to be that individual person coming through. And it can also be really helpful when we have that whole system to get a better idea of the history of what's going on for that person, especially for the pediatric patients. Sometimes when we have a teenager or a little one, right, they're not the most reliable self-reporters, they're not going to get the best picture of things. But when we harness those relationships with the family system and really the patient as a whole with their family, that can help us tremendously too. And our friends and family can also be protective factors. They can be people for our patients, right? For those patients, their friends and family can really help them to be more resilient and to be able to face more challenges. But again, if we help them to really understand the complexity of what's happening and walk them through slowly, that can really make a world of a difference in helping them to prep and prepare and to do things. Again, strengthening their coping by emphasizing positive and adaptive coping can also be really important for patients. Adaptive coping is really strategies that include actions and behaviors that create positive reframe. So adaptive coping is like having something that is going to highlight like something beneficial. So for example, let's say someone before used to like really like to read and that was their coping mechanism, but now they don't have the same concentration that they once had. They don't have the same like, level of ability to dive into reading. So adaptive coping is saying, okay, you really liked literacy before. How can we still incorporate that into what you like to do? Maybe there's audiobooks, or maybe there's podcasts, or maybe there's like even like art in a book, like books that are just going to use art as a storytelling, right? Looking at for different new adaptive ways for them to engage within things. Maybe you were a musician before, but right now you're too tired, so maybe it's going to go see live music. Really encouraging patients to utilize the coping that works for them and being adaptive, being positive about how we can reframe it in the now to be able to use that to their benefit. And again, highlighting that like that can encourage resiliency and their ability to cope through these challenging things, right? That are going on in their lives, not just physically, but also psychologically, mentally, the things that they're facing. Sometimes the mental block that they have might be stronger than the physical inability for them to do the things they used to do before. And that our minds are powerful and strong and can really hinder us sometimes or block us. And so it's encouraging patients, hey, what's something that worked for you before? You look like you've been going through it this week. What's something that you really enjoy doing? And really supporting them through that. Also, things that we can do, listening to our patients, right? Listening to them as they describe their emotions and concerns in their own words. We can provide connection to counseling, right? We can provide encouraging them to connect with the people, the systems that support them. We can encourage them to identify new ways to cope. Sometimes that looks, hey, have you ever tried doing this? I really like to go on walks. Have you tried that? I really like art. Have you tried coloring? And I know sometimes for our patients who are like adults, they're like, I don't want to go color. But there are different coloring things for adults. There are things called Zenimation, which is like a mindfulness form of, or Zentangling. So it's basically just like doing a bunch of swirls and things like that are with different colors that can create a lot like a form of mindfulness. So just encouraging them with different things that they can do and normalizing that it's going to be a challenging road and you're going to have a lot of fears, but you are here and we will be present to support you through your treatment. Your role really helps support them as well. And so I also want to highlight the importance of considerations for caregivers. There was a 2022 meta-analysis that looked at different research from studies all across the globe. So it really just took an analysis of what was the prevalence of depression for caregivers for oncology patients. And they found that about 42% of caregivers were experiencing some form of depression or like symptoms related to depression. So, what does that mean for us? It means that our patient, again, oftentimes includes that family system that they live within, it includes their loved ones. And sometimes we also need to encourage those caregivers, those loved ones, the spouse, the child, the family member that's joining them, and say, hey, do you have support as well? You're dealing with a lot. Maybe they've watched their loved one completely change and deteriorate. Maybe they've watched their loved one really change in terms of like independence. And so what they're dealing with is also emotionally, physically, and mentally exhausting because they've now watched their loved one completely change and shift. And that's not easy, right? It's not easy to watch somebody who maybe was once healthy now be faced with the most challenging of health times. So it's also important for us to encourage our caregivers who are walking through that door to take care of themselves so that they can continue to support their loved ones. The analogy I like to use with this is pouring into our cups, right? A lot of people talk about that. Oh, yeah, we pour into our cup. But if we don't pour into ourselves first, we can't pour into others. And I like to take that a step further and say, I really love iced tea. I drink a lot of iced tea. I love caffeine. Maybe you guys do too. Maybe your favorite drink is like iced coffee, but think of, or coffee or a hot tea. Think of your favorite drink. If you make a big old pitcher, a gallon, like a liter of your favorite drink, and you start to pour out into everybody else, you're like, okay, I have my spouse, I have my children, I have my loved ones, I have my work, and you pour into everybody else, but then you never pour into your cup, or by the time you pour into everyone else, you get 10%. That sucks because, like I said, I love iced tea. And if I don't get to pour into my own cup and I don't get to enjoy the things that I love, then I'm only going to be giving myself 10% while I'm trying to give 100% to everybody else. So that's why that analogy of pouring into your cup first is so important because if we use that, even with our caregivers and our patients, hey, you have to take care of you before you can take care of other people. If you don't, then you're going to be left with nothing and you can't run off of nothing.
And I think I'm going to reemphasize, like I always do, because I think it's just honing home what you said. Some of these caregivers, guys, that we have to remember, I just know in my experience, don't feel like they can show that this is affecting them to the actual patient because they feel like, well, I need to be strong for my spouse or whoever's going through treatment. So therefore, if they see that I'm weak, or some patients we know don't want to stress out their loved ones. So they might hide how much pain they're in or the distress that they're going in because they don't want to add an extra burden to that. So it's like a never ending cycle. I have an experience one time where a patient's wife, I could just tell as she walked past my desk every day and I saw her husband, the patient, declining, that it was just that eye contact that her and I made. And I stopped what I was doing. I went around and I said, do you want to talk while he's in the treatment room? And she said, oh my gosh, yes. So we went in there and she just broke down. And you could tell that she had not been crying in front of her spouse for probably weeks because she was holding it all in. And so I said, look, if this is what you need to let your feelings out, his treatment's taking 30 minutes, and we can talk, we can do everything. You can need that support. And that did her wonders. And then obviously we got hooked up with our amazing social workers, because maybe it's just once they leave the clinic, they're caring for those spouses 24 hours a day. They don't have time for themselves. They don't feel like they
Yeah.
can. When sometimes just these social workers that we work with know of resources that can provide someone to maybe stay in the house to watch their spouse for a couple hours while they can take time for themselves, which I think is very important.
Yeah. Yeah, absolutely. And I think even just to highlight what you were saying of they're seeing the patient day in, day out, 24/7. You can think of even how we were talking about before about the burden that the work that we do can be for us and the interactions we have within our clinic, but we can walk away from work and go home and have something different, and they can't in these times. Their caregivers are really just in it with them, with the patients, and they are just as prone to having mental health challenges and to having needs as
Right.
our patients. And
Yep.
like you said, they're doing that day in, day out. And sometimes the small connections that we make can make a big difference for them to be able to have support too. All right, so other mental health considerations. I know that this is like a challenging topic, we're getting through it, but also depression is really a common experience for patients in response to their diagnosis. They have higher levels of pain usually when they're in treatment, right? They're having a complete shift in maybe their identity because maybe they're starting to look different, maybe they're not able to be as independent as they were. So that's going to impact their self esteem. It's going to impact their emotional well being, right? And so they're going to already have all of these things that are impacting them that could lead to symptoms like depression. That can look like losing interest in normal activities, feeling sad, hopeless, spontaneous crying spells. I know sometimes patients will say, I can't stop crying and I don't know why. And that is because they're going through a lot of things, right? Depression can also look like changes in sleep, sleeping too much, not enough, changes in your appetite, losing your appetite, having difficulty concentrating, difficulty making decisions, being irritable, restless, having loss of interest in things, and having fatigue, and even experiencing thoughts of harming themselves. And so these are things to consider. I'm not saying this to be like, oh, this is what's going to happen, but it's just being aware that our patients are going through a lot and depression can impact them. And if you see this, it's also bringing that up to their provider, finding ways to connect them to support, because while they're dealing with these different health challenges, while they're facing their cancer, while they're facing their treatment, maybe even they have other health considerations and other health diagnoses that are on top of that they're dealing with. It's really important that we are aware that this is what it can look like if someone is experiencing depression while they're with us. Symptoms attributed to minor depression look like this still, but they can often resolve within about 2 weeks or less. Whereas if it lasts for longer than that, then they really might need a little extra support and connection to like a counselor or someone who can help them. So briefly, I'm not going to spend a ton of time on this, but I really want to highlight here that what's happening with our brain when we're stressed out or we're going through something stressful is in our brain happening in two specific main parts that then impact our whole body. When we experience a stressful event, whether perceived threat, worry, work, or home related, the amygdala sends a distress signal to our hypothalamus. And our amygdala is part of the brain that is central to our emotional processing. It's like helping us to regulate the emotion, and then it serves as a way to communicate with the rest of our body that whether or not we have the energy to face that stressful event. So think of the hypothalamus as the command center, right? Communicating with the rest of the body with our different systems and triggering different things. And so we're going to dive into that a little deeper in this next slide. I'm sure you might have heard of the stress response before. The fight, flight, freeze, fawn is what we call it. And I really want to highlight the fight, flight, freeze. I like to describe fawn as if you have a pet. I don't know if you guys have like a pet dog or dogs in general. If you know how they act, some people are cat people, some people don't like pets in general. That's okay. But dogs, when you are reprimanding them and you're like, don't do that, don't get into that, dogs will be like, okay, and tuck their tail between their legs and like go about and go do what they didn't really want to do, but they know they're in trouble. And that's the fawn. I use that to describe the fawn responses. Like, okay, I don't want to do that, but I don't want to get in trouble, so I'm just going to go along with it. it, even though I don't want to do it. So our autonomic nervous system is comprised of different parts. Two of them specifically are the sympathetic and parasympathetic nervous systems. They are responsible for different parts of our body relaxing or contracting. So our sympathetic nervous system is elicited or activated when we're in our stress response, in our fight, flight, freeze, fawn response. This happens when we have prolonged periods of exposure to stress. So think of what I said before, toxic stress. In that fight, flight, freeze, adrenaline is released, and what's happening in our sympathetic nervous system, as you can see on the right, you are activated. So you have an increased heart rate, your pupils get dilated. Maybe you have like racing thoughts. Maybe for some people, it looks like sensitivity to like their stomach. Like all of a sudden, they're just like, they feel it in their stomach. When you're in that stress response, maybe you can feel your heartbeat because it's so increased. And you're having overall that activation of something is wrong, something you're in trouble. That is our sympathetic nervous system telling our body, hey, there's danger. We need to take care of that now. That was really helpful. The stress response was really helpful when we had to like worry about external stimuli within the world way back when going outside, or we lived outside rather, and there was no differentiation between the outside prey and being within the world. Now we have some protective factors with all of that, but our body still interprets something like a stressful event with our health as, hey, look, this dangerous animal is going to attack you. Our body is interpreting it the same exact way. And then our parasympathetic nervous system is what tells our body, hey, it's okay, calm down. You can rest and digest. Your body can then, in that point, with the parasympathetic nervous system, calm down and say, hey, everything's going to be okay. That dangerous animal, aka your cancer, it's going to be all right. We're going to feel our way through it. What's happening at that point, as you can see on the left, is we're able to have a slower heart rate. We're able to breathe a little clearer. We're able to really go about normal life. Within that stress response, and why I'm highlighting this right now is again to bring up that toxic stress, prolonged exposure to elevated heart rate, to racing thoughts, to not being able to digest normally, can impact not just our physical body and our mental body, but like everything in how we interact within the world. Toxic stress refers to that prolonged activation of that stress response, and it can disrupt our development, our brain, our systems. And if you think about it, someone who's already going through cancer treatment, on top of that, having this prolonged exposure to stress, a lot of that can be really detrimental to their overall well-being, right? High doses of stress and adversity that we're constantly facing in life and even in early development can lead to prolonged toxic stress and can impact us in a lot of different ways. As you can see on this page, I highlighted just even that we have, as I said before, the positive, tolerable, and toxic, but that toxic stress really puts us into our bodies into thinking that we're in grave danger in the now, and it can make it harder to adapt to life. But again, to highlight resiliency can really disrupt the challenge that we face with toxic stress. That parasympathetic nervous system being elicited and helping us to rest can be so helpful. And I'm going to talk about ways we can do that in our third portion, but I just want to highlight that toxic stress, prolonged exposure to stress, can continue to impact our patient's health negatively, which is why it's so important for them to address their mental health and to address ways that they can do better. All right, we're going to do a Zoom poll question again. What is the autonomic nervous system, or what part of the autonomic nervous system is responsible for bringing out the stress response and bringing us back into the rest and digest? There's A, sympathetic nervous system, B, enteric nervous system, C, parasympathetic nervous system, and D, somatic nervous system. What's the one that brings us down, that calms us back down? Something that I used to help me with this, and at the end of the day, remembering specifically if it's the sympathetic versus parasympathetic nervous system isn't as important as remembering that there's a part of our body that helps us to rest and helps to bring us out of it. That's what's most important. But it is, the correct answer is, I think we are done with participants. It is the parasympathetic nervous system. So I want to highlight that while it's good to know that the parasympathetic nervous system is what's responsible for bringing our body out of the stress response, the most important part is understanding how we can help patients to get out of stress, which is what we're about to talk about. So I really want to highlight that the parasympathetic nervous system can activate a way for our body to calm down. And the most important part is remembering that there is a part of our body that does that. All right, we are almost through. This is something that I just want to quickly say. I'm not going to dive a ton into trauma-informed care, but I wanted to highlight that there is a concept called trauma-informed care that's a framework of understanding the health of our patients and the people that we're interacting with, that really understands that everyone's coming from a different lived experience and different life that might be triggered by what they're going through in treatment. And that sometimes when you have those patients that react really intensely to something, it might be not even anything to do with what's happening in treatment and just what their lived experience is coming into that. And so the main tenets of trauma-informed care are that we are understanding that there is a prevalence of trauma and adversity that impacts health, recognizing the effects of trauma and the adversity on their health and behavior, and then training us as staff on how to respond to patients with best practices, integrating that knowledge into how we interact with them, and then trying to avoid ways of re-traumatizing them. And if you get anything out of this whole lecture, I want to highlight that it is shifting our mindset with our patients of, hey, what's wrong, to what has happened with you right now. If you notice a shift, if you notice a huge change, it's shifting from what's wrong? What happened? What's wrong? To, hey, I noticed a shift. What's happening? And how can we help you in this now as you're going through treatment today, or as you're in your follow-up appointment today? What's happening now? And really, the biggest important part of trauma-informed care is that it's earning trust. It's communicating with compassion and curiosity instead of making assumptions. Our patients and the people around us are all coming from different lived experiences. And trauma-informed care really, as we've said, highlights a lot of the things we've already talked about of building that trust with our patients, of empowering them, of giving them choice, of giving them power and control, and collaborating with our patients. How we come across the world includes not just our words and our language, but also our facial expressions, our tone of voice, how we are interacting with them if we're making eye contact versus looking at a computer screen or looking at a piece of paper. Our engagement really tells patients how we're doing and how we care about them. And then I just wanted to quickly, I don't want to spend too much time on grief, but I do want to just highlight that grief is a big part of our patients and their cancer journey. A lot of times we attribute grief to just when someone has passed, but grief can also be experienced when your identity shifts, when you go from being an otherwise healthy person to now having a cancer. And that can really impact our patients in a lot of ways, creating a sense of concern about what does my identity look like because I'm different, and because now I'm faced with a life-challenging health event. And so that can look like a lot of things. That's the biggest takeaway I want to put here, that it impacts them psychologically, behaviorally, and physically, but that grief is really normal in our oncology patients, and it plays a role into even how stressed out they are. And with that, we're going to jump into how we can encourage coping and what that looks like, and really understanding what adaptive coping looks like and how we can address our stressors, not just for our patients, but also for ourselves. So we're with stressors and with what's going on with our patients. Doing something as simple as checking in with them when you notice something is different can make the world of a difference. Really working with your teams. Our radiation therapists also see our patients day in, day out when they're on treatment. And as I said before, connecting them to those social supports that they need can all be ways that we address the stress that they're going through. If we encourage those protective factors like the family systems they live within, the communities that they live within, then the smallest things of just talking about it can encourage them to engage with those protective factors in their life. So again, what is adaptive coping? It is healthy, effective strategies that we can use to manage our stress and our emotional distress. It's tangible mechanisms to provide support. So art, music, coloring, grounding techniques, diaphragmatic breathing, which we're going to practice in a little bit, meditation. Something I like to highlight when I talk about meditation too is a lot of times people can have assumptions about meditation if it's not something, a practice that they already integrate. But I like to tell patients, if you are a spiritual person or a religious person, even like prayer is a form of meditation. And what we've found in research in the last 20 years is that it's literally is the same, that prayer and meditation are the same. So if you're dealing with someone who is religious in any way and prays, that is a form of meditation and is just as effective as mindfulness and meditation. And then again, emphasizing those support systems. Who feeds us? Who gives us energy and who gives us that breath of fresh air? That's the people we want to include in our lives, especially in these times, whether you're a patient or a provider. How can I be given to versus the energy being taken away from me? And more important considerations is just developing awareness of your own cultural values and beliefs and biases in relation to the people that you're dealing with in work. Even if you live within a small, tight-knit community, every person and individual in their family looks different when it comes to cultural values or values of their family. So it's also important for us to develop awareness that the patient is the expert when it comes to this is what's normal for me and my family, and really encouraging that. Remembering that coping is not a quick fix. Sometimes I like to describe it as when you're working out and the first time you work out, maybe you can only lift 40 pounds once. If you keep activating that muscle, you keep working out, after a month, 2 months, maybe you're lifting 60 pounds now. Maybe you're lifting more, or maybe you're doing more reps of the 40. Coping is not I did it once, why isn't it working? It's a active muscle that we have to really encourage our patients to do, to not give up. And also just reminding them that something that you enjoyed before might look a little different now. Find new ways to engage in those things, and also encouraging them to seek help from a professional when they notice that they need more support. There are a lot of supports out there, and encouraging them. This is just a quick description of diaphragmatic breathing. Stress presents in our bodies in a lot of different ways, right? And we can learn to train our bodies to activate our parasympathetic nervous system to relax. And we're going to practice this actually after the next Zoom poll, which is about to happen. But diaphragmatic breathing elicits our vagus nerve. And I put this little image so you can see where it's at. But basically, we can trick our body into telling it, hey, calm down, breathe clearer, have a clearer mind, lower your heart rate. We can trick our body into doing that by eliciting this nerve in our body with diaphragmatic breaths, with box breaths. And so we're going to practice that in a little bit together. But first, just wanted to have a quick poll. What is considered adaptive coping? A, effective strategies, sometimes new, that we can use to manage our stress and emotional challenges. B, doing things we really enjoy even if it only provides short-term relief. C, challenging our emotions by focusing on the emotion we felt when we experienced something stressful. Or D, withdrawing from things that you enjoy when stressed out so that you don't ruin them with negative memories. What is adaptive here?
Yeah, that's great.
Okay, we're going to end the poll. Yes, it is indeed. Adaptive coping is A, effective strategies, sometimes new, that we can use to manage our stress and emotional challenges. So again, adaptive coping is something that we can use to manage our strategies that we can implement to manage the challenges. It's not always something that we've done in the past, but it's obviously something that can be new or old, but that will find new ways to help us cope in the moment. It's something that can help us to manage distress, stress, emotional variability, but it can technically include new things or old things. So A is the correct answer. All right, our last little bit of action in how we can practice mindfulness is going to be box breaths. This includes at least 3 diaphragmatic breaths where we inhale through our nose for 5 seconds, We'll hold it for 6 and we'll exhale for 7 to 8. So let's practice this together and I'll walk you through it. If you feel comfortable, just find yourself seated in a comfortable position. And I want to invite you, if you feel comfortable, to close your eyes, to be present in this moment if you're comfortable doing so. And if not, that's okay. You can keep your eyes open. But what we're going to do is we're going to take 3 deep breaths. And we're going to start with an inhale through our nose and then it'll exhale through our mouth. So if you're ready, you're going to take a deep breath in through your nose. 2, 3, 4, 5. Hold. 2, 3, 4, 5, 6. And exhale through your mouth like you're breathing out of a straw. 4, 5, 6, 7, 8. Inhale through your nose. 2, 3, 4, 5. Hold. 2, 3, 4, 5, 6. And out like you're breathing through a straw, through your mouth. 6, 7, 8. One more deep breath in through your nose. 2, 3, 4, 5. Hold that. 2, 3, 4, 5, 6. And out like you're breathing through a straw. 2, 3, 4, 5, 6, 7. Okay. Thank you for doing that with me. Box breaths can elicit that parasympathetic nervous system, help us to have clearer thinking, to pay attention. And here are just some more techniques overall that you can utilize. Body scan, just noticing where in your body you're feeling sensations, mindful walking, mindful eating, and just being present in the moment. This can look like a lot of things, but overall, what this does is reduces stress, anxiety, improves focus and concentration, and it enhances our awareness, and it promotes emotional regulation, not just for ourselves, but also for our patients. And it can increase feelings of calm and well-being. So these are some helpful tips.